talk about this hydrocephalus. What is hydrocephalus? Hydrocephalus is excess accumulation of cerebrospinal fluid in the cranial wall. This is characterized by two things, that is increase in volume and increase in size of the ventricle, that is progressive dilatation of the ventricle. Two things are there. And Greek word, that is hydro means water and cephalus means brain. This from which hydrocephalus Greek word is derived from Greek word. So this is about definition, and two or three things we must know before going to the classification of this. Usually 150 ml cerebrospinal fluid is present in this, that is in the ventricles and in subarachnoid spaces. This out of 150 ml, 100 ml is present in the 110 ml is present in the subarachnoid space, and 40 ml is present in these ventricles. And there 500 ml of cerebrospinal fluid is formed daily. That means that this cerebrospinal fluid is replaced 3 times in a day. Out of this, 50% is formed in the lateral ventricle, and 40% from other ventricles, and 10% from the blood vessel, meninges, etc. This cerebrospinal fluid, we know that it is formed by choroidal plexus and absorbed from, this is an active process, and this is absorbed from this arachnoid villi, arachnoid villi, that is arachnoid matter will enter into the protrude into the dural venous sinus, and in the dural venous sinus there are many villi, and when there are many villus and when villi, and this is collectively known as arachnoid villi. This is one villus, we take one villus, and this will work like a valve, that is one-way valve. Due to pressure gradient, pressure is more in the CSF side, that is in subarachnoid space, pressure is more, and it will go into the dural venous sinus. It will go into the dural venous sinus. But when the pressure of dural venous sinus is more, it will become, this is blocked. This will close. It cannot come into the subarachnoid space, one way. And volume is, formation of CSF is constant in health, therefore usually this is due to pressure increase or decrease, usually occurs due to absorption of the cerebrospinal fluid. 80% of cerebrospinal fluid CSF is absorbed from arachnoid villi, 80% absorbed from 20% from other side, that is perivascular space or lymphatics in the spinal region. This is about the absorption. Now circulation. It's a circulation. 50% is formed from lateral ventricle. Cerebrospinal fluid moves in the third ventricle through foramen of Monoro. From third ventricle it moves into the fourth ventricle through aqueduct of Sylvia. From the fourth ventricle it will go into the spinal canal. It will go into the subarachnoid space through foramen of Lasca and foramen of Magendie into the subarachnoid space. So there are 4 ventricles, 2 lateral ventricles present in telencephalon, 1 third ventricle present in the diencephalon. This aqueduct of Sylvia is present in the mesencephalon, that is midbrain, and 4th ventricle is present in the rhombencephalon. This will go. And subarachnoid. What is subarachnoid? Subarachnoid space is a space between this pia mater and arachnoid mater, and there are 3 defined dilatation at fixed points. They are known as cisterns. There are 3 are cisterna magna, that is from medulla and under surface of cerebellum, then cisterna pontis, ventral surface of the pons, and in this cistern the basilar artery is present. Then cisterna, this bacillus, that is cisterna It also known as cisterna interpeduncularis, and it lies between the tips of temporal lobe. In this cisterna, bacillus circulovirus is present. This is about the, and this will circulate like this. Therefore, in external types of hydrocephalus, that is of three types. Pressure is one is where pressure is increased. This is known as external hydrocephalus or communicating hydrocephalus. Second is internal hydrocephalus or non-communicating hydrocephalus. External communicating type may be congenital and acquired, and this is also congenital and acquired. In external communicating hydrocephalus, there is defect in the main defect lies in the arachnoid villi. This arachnoid villi is site of absorption, and congenitally it may be defective, it is not working properly, and acquired, this may be blocked by excess amount of cells, excess number of cells, excess amount of cell debris or protein, and this is blocked, and there is no absorption of cerebrospinal fluid, which will lead to accumulation of cerebrospinal fluid. This will accumulate in the subarachnoid space, and after that there will be backward pressure in the these ventricles and cistern, etc. This is external communication. Internal, that is non-communicating, that there is communication is blocked. This may be congenital and acquired. Congenital means usually this aqueduct of Sylvia, there is atresia of aqueduct of Sylvia, and other foramen may be blocked due to acquired, due to infection or bleeding, etc. The cells, cell debris and protein in excess will block this space. This will block the drainage of the cerebrospinal fluid. And second is normal pressure hydrocephalus. Normal pressure is that occurs usually in episodic. Sometimes the pressure will increase, after that it becomes normal. It usually occurs in brain injury and during sleep. And third is that is not actually this hydrocephalus. This is known as ex vacuo. Ex vacuo means when the brain tissue get atrophied, when there is atrophy of brain tissue, brain cells, as in old age, then to occupy the space, this subarachnoid space will dilate, other things dilate, and there is accumulation of cerebrospinal fluid. This is actually not a type of, not a classical hydrocephalus. So this is about the this hydrocephalus. What is the definition? That is excess accumulation of cerebrospinal fluid in the cranial cavity is hydrocephalus. This is of three types. First is where pressure is increased, that is external communicating, or internal non-communicating. Both are maybe, that is external communicating may be congenital or may be acquired. Likewise in internal or non-communicating type, it may be congenital and acquired, and normal pressure. This is about this. And in external or communicating type, the defect lies in the arachnoid villi. Arachnoid villi may not be working properly, therefore there is no absorption, or arachnoid villi may get this blocked, choked due to presence of excess cells or sex debris or protein material. This will cause blockage of the this villi. And second is internal or non-communicating. This may be also congenital and acquired. Congenital means there is atresia of the aqueduct of Sylvia, or any foramen may be blocked, may not be present or may be blocked. And acquired when it is, these foramen are blocked due to cell debris and protein, etc. So there is, and normal pressure, I said, it is episodic and occurs during sleep, especially in case of brain trauma. And ex vacuo when there is destruction of or atrophy of brain tissue, the capacity, the volume of brain is reduced, and then for excess amount of this cerebrospinal fluid accumulates in the cranium. When symptoms and signs, when this is congenital or before fusion of the skull bones, the skull bone will increase. The size of the skull will increase slowly and causes formation of macrocephalus. That is macrocephalus, large skull is there. And after fusion of the bone, or cranial bones, there may be pressure effect only in the brain. That is loss of memory and higher function, which is going progressively. In case of any doubt, diagnosis is done by physical examination, history, CT scan, MRI and nucleotide, and treatment is available for this hydrocephalus. So, thank you.